1.
Welcome to Framework Analysis for Common Spirit Health, presented by Group A by I, Jenny, and Scott. Common Spirit Health, the recent merger between two large hospital systems, namely Dignity Health and Catholic Health Initiative, a combined $28.4 billion not-for-profit health system, which includes Houston, Texas. In the market overview, Common Spirit Health now spans 28 states with little geographic overlap, 139 hospitals, 25,000 physicians, 159,000 employees, revenue of $28.4 billion a year. As with any merger, CHI and Dignity Health will need to integrate key portions of the combined operation while continuing to deliver high-value, cost-effective care to patients and other stakeholders. We chose to focus on Houston because CHI had an existing presence in the Houston market while Dignity did not. Through this merger, Dignity, in the form of Common Health, gains access to Houston and its 6.6 million residents. Its 2.3 million residents in the inner part of Houston, its geographic diversity, including the fourth in the number of Hispanics and seventh in the number of African Americans, and is the fifth most populous metro area in the nation. Now, to the presentation of stakeholders by IA.
Thank you, Jenny. Although there are many stakeholders in this merger, we will focus on patients and physician providers. Both of these stakeholders will be greatly impacted by the merger of these two systems. Providers are likely to have mixed feelings, as some will prefer greater resources and easier collaborative abilities during the decision-making process, while others may feel a decrease in autonomy and a greater sense of being controlled by a corporation. Patients will benefit from the patient-centered care approach that increases access and coverage throughout the city and surrounding area. Additionally, increased resources should translate to improved health outcomes and an increased patient satisfaction with the healthcare system. However, as with any major change, there are some losses. And for patients in particular, some may lose their care team due to the restructuring process. And now an analysis of the healthcare system with a discussion of its potential innovations and the financial advantage. It has been said that innovations can be used to improve healthcare in three ways. 1, to change the way consumers buy and use healthcare. 2, to use technology to develop new products and treatments and to improve healthcare delivery. Or 3, generate new business models, particularly those that involve the horizontal or vertical integration of separate healthcare organizations and activities. Common Spirit is positioned to improve healthcare by addressing one or more of these types of innovations. For example, it can make obtaining care more patient-friendly by integrating a mobile app where appointments can be scheduled, wait times can be viewed in real time, and virtual check-ins can occur. Additionally, properly vetted best practice protocols can be coded and implemented into the shared electronic healthcare system to improve care and outcomes. And finally, an analysis of pre-merger business models is likely to reveal a variation in patient experience, outcomes, and satisfaction. Standardizing this to a more successful model across the system will likely yield more favorable results. Such innovations can be easily implemented into the new healthcare system as the technology for these currently exists. The limiting factor for their execution will be finding the financial backing and the value of such changes. However, if the hospital leadership is able to pilot a program with these changes, they may be better positioned to garner the funds needed to bring these products to a larger audience. And now back to Jenny for a discussion of finance.
Dignity Health has benefited from a strong operating revenue for the past several years, experiencing an increase in compound annual growth rate for at least the past 7 years. Meanwhile, according to recent reports, CHI has experienced a decrease in acute admissions, with approximately 5% year-on-year. Prior to this merger, outpatient surgeries in CHI was down approximately 5%. The effects of these volume declines were somewhat mitigated by the combination of improvement in revenue cycle and reduced operating expenses. Hospital mergers, especially horizontal mergers with an increase in geographic locations, should theoretically result in cost savings. There are potential industry profits from such a merger that allows the newly combined system to internalize pricing across the whole market. By internalizing these cost differences means that a hospital merger could increase the total payments made to the hospital as a whole. However, some economists argue that costs may actually increase, especially in acquired hospitals, where infrastructure will need to be established, or that quality may decrease. As with any merger, operational differences with the emphasis on value of care, especially quality, needs to be monitored. Now to Scott for recommendations.
Thank you, Jenny. We recommend 3 distinct but interconnected approaches to successfully manage the merger of these healthcare systems. First, adopt a balanced scorecard approach to measurement and management that values economic and non-economic results. Second, determine gaps in needed capabilities and craft a plan to address any shortcomings. Third, place patients and other stakeholders in positions of power to ensure their voices are represented in key decision-making processes. Our first recommendation related to utilizing a balanced scorecard is essential for achieving results that are not based solely on economic outcomes. What gets measured gets prioritized, and what gets prioritized ultimately is more likely to actually be accomplished. Significant emphasis should be placed on patient satisfaction, clinical outcomes, and community engagement. The balanced scorecard can be further operationalized by dismantling traditional business structures in favor of a structure built around key patient populations. Clusters of activities could be grouped to meet patient needs. For instance, patients receiving artificial joints will need surgery, physical therapy, and possibly a customized set of social services such as help with grocery shopping or household chores. Our second recommendation, addressing gaps in capabilities, is critical because every organization falls short in certain areas. Embracing reality and devising a structured approach to identifying and resolving major gaps is imperative to creating not only a better functioning system, but also a healthier, reality-based culture. Strategic, operational, and clinical experts should examine key performance indicators to determine where gaps may exist that inhibit the attainment of the organization's mission, including clinical and financial goals. Mitigation plans should then be put in place to fill these gaps and bring all key areas up to a reasonable level of performance. Our third recommendation, placing key stakeholders, including patients, in positions of power, is essential to a well-run, inclusive organization. By populating its boards and other governance roles with actual consumers of its services, Common Spirit can sidestep the insular thinking and decision-making that undermines so many organizations. This means a broad cross-sections of stakeholders should be represented in the decision-making process. Not only will this improve decision quality, it will serve as evidence of Common Spirit's commitment to its nonprofit mission and in the community it cares for. In the event of conflict among this group, a clear governance process and decision-making hierarchy must be established to ensure the mission is kept central to strategic choices. The impact of the suggested changes have the potential to improve the experience for stakeholders across the innovation and finance dimensions. By leveraging the strengths of each organization and capitalizing on its newly combined power, Common Spirit can positively impact the market in significant ways. As it relates to Carrie's tagline of business with humanity in mind, both of these dimensions can work individually and more powerfully, collectively, to drive positive results. By creating a culture and operating environment that values holistic care of patients and strong partnerships with the community, leaders can engender a culture that benefits not only patients, but all Houston area stakeholders. Thank you for your time.